yourself. Again, okay? Hi ma'am, hi sir, ako din si Prince. Trained first aider, pwede mo kumutabang nimo. Okay, that's how you introduce yourself na siya. You can use Bisaya, you can also speak in English na siya. Okay, na siya. The next one is you have to check for responsiveness. How do you check for responsiveness? Okay, so you have to tap the shoulder of the dummy na siya. So either child or adult. So, hey, are you okay? Hey, are you okay? Sir, okay na ka sir? Sir, okay na ka sir? That's how you check for responsiveness. Okay, the patient is unresponsive, then I need to call for help na siya. Okay, so in front of you, you have your assessor. So pretend that the assessor is the bystander or kinsang maganin na siya. Then you can ask him for help na siya. Sir, ma'am, okay, papalihog ko kanang tabang na tawag ko ambulance. Then balik na ko for any updates na siya. Okay, so after calling for help, check pulse and breathing for about 10 seconds na siya. Okay? Now there are techniques on how to check the pulse and breathing na siya by using the LLF, which is look, listen and feel method na siya. Unfortunately, kanang gitangtang na siya sa American Heart Association. Okay? How do you position when we check the pulse sa una and breathing na siya? So when we say look, we look at the rise and fall of the chest na siya. When we say listen, we have to listen to the nose of the patient, whether nabay ginhawa or wala. And when we say feel, we are going to feel the carotid pulse of the patient, whether nabay blood flow or nabay pulsating force or wala na siya. And this is how we position. And we have to count for 10 seconds, 1001, 1002, until 1010. But because of COVID na siya, okay, as much as possible, we have to distance between the patient na siya. Because if we come close to the patient, remember, COVID can also be an airborne na siya, communicable disease. So there's a tendency na what if the patient dies of COVID virus na siya or na-collapse because of COVID na siya. So pwede yun niya magawas ang COVID virus towards you na siya. Okay? So to make it sure na safe na dyan ka, igo na lang ka mag-feel o look siya chest for 10 seconds. 1001, 1002, 1000, okay? But during the assessment, most of the assessors are not actually updated pa. Dili pa wa pagin sa idea that there are changes in the CPR na siya. So you can just use the look, listen and feel method na 1001, 1010. No pulse, no breathing. What do we do?
CPR.
Okay, so that's the time we will perform CPR na siya. Okay? So when you perform CPR, if you have an adult na patient na siya, so duha ka kamot ang iyong gamiton. Bago na parang gamiton. Okay? So gamiton. Okay? Okay, dominant hand should be on the chest of the patient and the other hand will be the one to lock in as siya. And make sure that your shoulder should parallel gid or at banggit sa inyong chest gina siya. Ayaw pag-perform ng CPR na lingkod ka na dapat nakaluhod yung ka og straight gina siya na position. Then you can start with the compressions na siya. Then when you start compressions, make sure that you are also counting using your mouth na siya. Do not count using your mind na siya because you have your assessor observing you. Okay? And when you are starting the compressions, make sure that you're also looking at the face of the patient na siya. Okay? To identify whether na conscious na ba siya or still unconscious na siya. So, let's count. Ready? Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, and 1. Okay? 9 and 1 because it's your first cycle na siya. Okay? May problema kung dili musika na natong dami. Ano tas musika? Ni.